Did you know that 6.8 million Americans suffer from generalized anxiety disorder? If that were not distressing enough, according to the Anxiety and Depression Association of America, only 43.2% of those 6.8 million people are receiving treatment. That's right, only half of all people struggling with generalized anxiety disorder are getting professional help. I'm Sin. I'm a psychology major about to graduate with my bachelor's degree and move on to earn my master's degree with the goal of treating adults with anxiety. This topic is very close to my heart as I have struggled with anxiety for much of my life. And as we can see, so many other people in our society are struggling as well. There's a great need to treat this debilitating condition. Because the prevalence of anxiety is rapidly growing, it is extremely important to ascertain the best treatment plan for this mental health condition. The very question that drove my research is, what is the most effective treatment for anxiety? Today we'll be looking at the different kinds of psychotherapy and techniques for the treatment of anxiety with the goal of discovering the most effective treatment so that people who struggle with anxiety have some sort of direction and information when seeking help. Pharmaceutical medications will not be addressed here. The most important discoveries that researchers have made about the treatment of generalized anxiety disorder are that cognitive behavioral therapy, also known as CBT, and dialectical behavioral therapy, also known as DBT, are both extremely effective, although in different ways. In his book, Cognitive Behavioral Therapy, David Clark describes how CBT is considered to be the gold standard treatment for anxiety. Based on the notion that thoughts are responsible for anxiety, CBT aims to analyze thoughts and redirect them. Some techniques of CBT that are commonly used are called thought-stopping techniques. Another one is to recognize whether a thought is actually a fact or merely a story we're telling ourselves, which is causing our anxiety. Later, DBT, dialectical behavioral therapy, was created as a sort of branch off from CBT. In the Dialectical Behavioral Therapy Skills Workbook, McKay and Brantley describe DBT as being more heavily focused on the human experience as a whole, involving a lot of emotion regulation. So these two models, cognitive behavioral therapy and dialectical behavioral therapy, remain the main psychotherapy approaches for the treatment of anxiety today. While the evidence-based research supports the efficacy of both CBT and DBT, there exist other techniques for the management of anxiety. One of them is called progressive muscle relaxation, or PMR, and also breath work. While research shows that all of these techniques are helpful in the treatment of anxiety, it does appear that it may be more beneficial to employ a blend of approaches. By the way, progressive muscle relaxation, PMR, aims to calm the nervous system in a procedural way where the patient can focus on one muscle at a time or a group of muscles at a time. And what they do is clench the muscles as hard as they can and hold it for a few seconds and then relax and then move on, progressing throughout the body. The whole idea of this is to distract the mind, the heightened fight or flight mode, and calm the body down by redirecting to this clenching and releasing of the muscles systematically throughout the body. Breath work, as you can imagine, involves a lot of different breathing techniques. There are a bunch of different kinds, but it has been proven that slow, deep breaths are basically the only way to immediately hijack the fight or flight system. The slow, deep breaths force the body into a calmer state and also send a message to the brain that all is well, we're not in danger, everything is okay. So both of those techniques are very important as well. So the reason we want to employ a blend of techniques and approaches when treating people with anxiety is that people are unique. People are so complex and nuanced. One treatment plan can't possibly be the most effective for everybody. The etiology of anxiety is not the same for every individual, nor is the way the symptoms present. Not everyone experiences anxiety in the same way. So why would we treat it in the same way? In 4 different types of anxiety, licensed clinical psychologist Dr. Scott Eilers illustrates this very notion. The importance of utilizing these different techniques based on the patient and how the patient's symptoms manifest is paramount in effectively treating anxiety. According to Eilers' model, anxiety presents in 4 distinctive ways. Narrative anxiety is driven by inner dialogue and thoughts. So as you can imagine, the best treatment approach for this subset of anxiety would be cognitive behavioral therapy with its main focus on thoughts. However, visual anxiety is engendered by a negative or fearful mental image. There really isn't much thought precipitating this form of anxiety. Because this is brought on by a mental image, usually involving a fearful outcome of some kind, the best way to treat this patient would be to have the patient practicing creating images that are more neutral or positive as opposed to the original fearful image. Obviously, CBT wouldn't be the best option to treat that patient. A third subset in Dr. Eilers' model is called physical anxiety. This is when the patient suddenly experiences an onset of physiological sensations, such as a racing heart or sweaty palms, maybe an upset stomach or a headache. The onset of these symptoms typically occurs suddenly, excluding any precipitating thoughts. Here, techniques such as breath work can be very effective. As I mentioned before, the slow, deep breaths immediately help to calm that nervous system and shift us away from sympathetic nervous system back to the calm state of a parasympathetic nervous system. Finally, general anxiety is kind of a tricky subset of anxiety to describe because there's really no precipitating factor. People who suffer from this type feel basically a consistent and constant sense of doom. There are no thoughts or mental images. It's just a sense of dread basically all of the time. Because there's no cause and there's no way to combat this with a specific, image or thought or breathing technique, because it's so consistently doom-driven, this type of anxiety has been proven to be treated most effectively by a distraction, usually a distraction that engages the person in a pleasant way, something that doesn't stress them out more because you don't want to aid the anxiety. But the idea is to cut the supply of the anxiety off to the brain through the distraction technique. It could be a game, it could be a task, whatever the person is interested in doing, something that tricks their brain out of the supply of anxiety to the task at hand. So again, even though cognitive behavioral therapy is touted as being the gold standard, we can see how it does not apply to every situation through these examples. Okay, so after analyzing and interpreting all the evidence-based research on the treatment of anxiety, it is clear that although, like I said, all these different approaches are helpful in treating anxiety, there is no one modality that is completely effective in treating every subset of anxiety. What the current research has overwhelmingly failed to do is to approach the treatment of anxiety with the patient in mind from the outset. These treatment modalities cannot be studied in a vacuum and truly glean helpful data. It just can't happen. There need to be created more integrative studies. Rather than looking through the lens of the treatment modality, researchers and mental health professionals need to shift and look through the lens of the patient to determine the most effective course of action for the individual. Dr. Eilers' in-depth and insightful discussion on his model of the different subsets of anxiety and how and why those subsets inform his treatment approaches is what solidified my conclusion that no one-size-fits-all treatment plan for anxiety exists. It simply does not. In some cases, one modality may be all that is needed, such as with narrative anxiety. Maybe CBT is all that person needs and they're good to go. Other subsets may require a blend of 2 or more techniques or modalities to truly be effective. Because anxiety cannot be treated with a cookie cutter approach, we need to shift the way we look and look through the lens of the patient. Creating treatment plans based on the patient's unique experiences is imperative to the well-being of so many who struggle with this complex and truly limiting mental health affliction. At the rate anxiety is growing in our society, there is no time to waste. Mental health professionals need to look at their patients first to guide them to create the most effective treatment of anxiety for that individual. The well-being of millions of people depends upon this. Thank you for your time.